Do you suffer from complex regional pain syndrome? Hi, it's Dr. Ruth the Pain Doc, founder of Chronic Pain Rescue, a telehealth practice dedicated to partnering with those suffering from chronic pain to get them from chronic pain to pain-free. Complex regional pain syndrome, it's not necessarily that common a pain diagnosis, but yet it's common enough that you need to know about it. It is treatable, especially early on, and you do want to catch it early because it can be very debilitating. There are various stages of complex regional pain syndrome. It is a pain syndrome that has to do with dysfunction in the nervous system, but also the circulatory system. So in fact, it's the nerves that surround the blood vessels that have become affected, and the reason why there are changes with circulation in a certain area. So just as the name suggests, it is regional. If a person has total body pain, it's not likely complex regional pain syndrome, because it's only going to affect a certain part of the body. Where does it come from? Why does it start? Sometimes people may get, it used to be called reflex sympathetic dystrophy. That name was changed to complex regional pain syndrome. It can start after a stroke. It can start after trauma, such as a broken bone, a sprain. Sometimes it can happen where the person doesn't recall any incident or trauma, but yet they have it. And it starts off with a burning pain, very severe burning pain. And it also starts with inflammation, redness, increased warmth to that area. But then over time can develop change to the skin, and that the skin becomes shiny. And that can happen early on, the shininess to the skin. Over time, if it's untreated or progresses, it will become dull, and there will be atrophy, and there will be changes to the bone. As far as detecting it by any studies, the gold standard would be a bone scan. However, over my time, I haven't found that all radiologists know how to read that complex regional pain syndrome is the cause of the changes they're seeing on a bone scan, but triple phase bone scan is diagnostic. X-rays during the late stages of the disease will also show bone demineralization, so weakening of bones or less kind of faded areas in the bones, but that's a late finding. You don't want to, if you're seeing that, then you're further along in the diagnosis than you want. You really want to have a high sense of suspicion to get it diagnosed, because as I said, it's not necessarily top of mind as a cause of pain. But if someone's had a stroke, if someone's had trauma, and the swelling is very significant, burning significant, not all pain is a burning pain. Also changes to the hair follicles in that area, or nails in that area. Hair doesn't grow, and you can see that in that particular area there's a loss of hair, or there's changes to the nail bed. So early treatment, you want to use anti-inflammatories, things like Aleve, Motrin, naproxen, and other anti-inflammatories, or steroids, oral steroids, or even if you want to go with natural anti-inflammatories, that would include things like turmeric, boswellia. You can go to a health food store, they carry anti-inflammatories. Applying contrast baths, I think, is even better than just going with either heat or cold. Contrast baths, you would say maybe 5 minutes in cold, 10 minutes in heat, 5 minutes in cold, 10 minutes in heat, doing that over a period of 20 or 30 minutes. That alternation can help. Physical or occupational therapy can help, or at least movement can help. Because the tendency is you have a lot of stiffness, that joint, especially over time, and you want to counter that. You don't want to just give in to the fact that you don't want to move it. You want to still move it to continue to keep your function. There's some other treatments also. Some antidepressants which help with chronic pain, help with complex regional pain syndrome. Things like Cymbalta, things like amitriptyline, or anti-seizure medications such as gabapentin or Lyrica. Your doctor may, if you have its later stages, you may want to be on something to help with forming bone, things like Fosamax or calcitonin. Also, pain intervention specialists can provide nerve blocks. The stellate ganglion are kind of a ball just outside of the spinal cord, where a block to that nerve, an injection, which is guided. They know where they're putting the medication. It may be steroid, it may be some other medication, but it's going to basically cut off that pain, from the nerve root. And this may be repeated, but it is definitely effective for a lot of people in managing that type of pain and eventually getting rid of that kind of pain. Intravenous ketamine also, it can be very effective in low doses. Again, that's given in clinic setting, and that can help to relieve the pain and some of the other, emotional stress-oriented things going along, depression going along with that type of pain. There are some blood pressure medications, things like Minipress, which can also help with, or clonidine, which can also help with pain. As I said, I think contrast baths would be better than just applying heat or just applying cold. So you can try that. Some topical analgesics such as lidocaine, capsaicin cream, and just very light amounts. Capsaicin is an anti-inflammatory. It comes from cayenne pepper. You want to put a very small amount on the area, because if you put too much, it's going to burn and, counter what you're trying to do. I mentioned physical and occupational therapy. TENS unit, transcutaneous electrical stimulation. Basically, the theory behind that is that that's sending up electrical pulses to it's like the gate theory of pain. So it's blocking your central nervous system from feeling the pain stimulation by sending another counter stimulation. Biofeedback techniques can be useful for some people to help them relax and relieve pain. Spinal cord stimulation is another treatment that could be used. They would give a test first to see if it's effective, and then if it is, have a nerve stimulator implanted, and the battery would have to be changed a couple of years. And there's complications with anything that's being implanted. There's a risk of infection that is effective for some people. So just to keep that in mind. Intrathecal pumps. The intrathecal meaning it's going just below the spinal lining. So again, kind of pumping medication into that area to help relieve pain that way. Acupuncture also can be very helpful. It stimulates nerves, muscles, connective tissue to increase the blood flow and relieve pain. There's also something called mirror therapy, where it's almost like tricking the brain, where you would sit in front of a mirror box and move the healthy limb, but where in the mirror it looks like you're moving the limb that's injured, the limb that's suffering from the complex regional pain syndrome. But in that way, it's kind of reprogramming the brain to think that limb is healthy. I've put in other videos that how you think about your pain is important. Your brain will produce what you believe. So it's not, I can see where mirror therapy could help. And there's research showing that this can improve the function and reduce the pain in people with complex regional pain syndrome. So it's worth trying that. And of course, I know some other areas with some medications from homeopathy also that people use for complex regional pain syndrome. So there are a host of things. You don't have to continue to suffer. I definitely recommend going for treatment, trying things out. You don't have to suffer eternally. There is help. That's all I have to share right now. I'm available if you feel you'd like to work with me as a health coach, or if you're thinking about it, if you have questions about it, feel free to set up a free 30-minute phone consultation with me. That can be set up on @ChronicPainRescue in all the different social media platforms I have, or if you're interested in making an appointment, go to chronicpainrescue.com and you can set that up. It's a visit right in the comfort of your own home. Be glad to help you. Be glad to work with you. If you have any other questions as well, if there's topics you'd like me to discuss, you have questions, feel free to submit them, okay? And I'll be available for whatever way I can help. Until next time, peace and blessings.